Top Med Talk.
Nick Majerison here. Welcome to Top Med Talk. This is part 2 of COVID-19, a case study, Professor Monty Mythen. In part 1, we looked back at the moments captured on Top Med Talk where Professor Mythen may have had coronavirus. We were listening to what he was saying and how his symptoms started to develop. Now, though, we're going to listen to Professor Monty Mythen has tested positive. We appreciate the potential seriousness of this virus, and particularly healthcare workers in our team have had direct experience of it. This is the first half of this podcast. If you want to hear the second part, don't forget all of the links to all of the fuller audio clips that you're hearing here are available on topmedtalk.com underneath the show notes. Have a listen.
Top Med Talk.
Hello and welcome to Top Med Talk. I'm Desiree Chappell, lead anchor for Top Med Talk, and we are covering the COVID-19 pandemic from the front lines. Our conversations in the past weeks have spanned the globe, and we will continue to bring the latest updates as long as we can before we're called back into action. Now, I'm joined by our editor-in-chief from London, England, my partner in crime, my wingman, Monty Mythen. Hello, Monty.
Thanks, Desiree.
Well,
How are you?
I'm doing okay. I've been missing you a little bit. I know things are a little crazy over there for you. You've been feeling a little bit under the weather, and other years you would have probably just knocked it off to being, having a cold, having a little bit of the sniffles. But right now with the COVID crisis, this is a real possibility. So you decided that you were going to go in and get tested a couple days ago, I guess within 48 hours. And so let's have the big reveal. Are you positive or negative for COVID?
Yeah, so I'm no surprises. I'm COVID-19 positive because as my, going around at work is, if it looks like a duck and it smells like a duck and it walks like a duck, it's probably a duck. So the relatively mild signs and symptoms I had at the present day, it's spring, the sun is out. One has to assume until proven otherwise that it's COVID-19, and indeed it is. Now, I was able to get that selected test because as a frontline healthcare worker, we will try and determine of people who are symptomatic, who are looking at when they can return to work, whether it is a mild head cold, which is extremely unlikely now, or COVID-19, and it's COVID-19. So I'm quarantined, carrying on my quarantine now.
Right. Working from home. How long will you be quarantined, Monty?
So it's 14 days in total. Now, when did it start is the question with that, because there's a likely period. So, I've been self-isolating this is end of week 3 for me now. So I've been self-isolating in anticipation of joining the frontline workers and working from home and being an early adopter led by my public health colleagues of trying to work entirely off my laptop using different platforms to communicate in isolation. You could then ask how I think I got it, but that's what I was just going to ask that. We'll come back to that in a second. This all is a great explanation, I think, of why this idea of self-isolating as a family is so important. We're going to work on the basis that I'm about 5 days into it. So if we go for the 14-day strong self-isolation, the advice from work at the moment is let's review the situation where you're completely symptom-free for 3 days. And we'll take a view then. Mm-hmm. So we'll see when that happens, because many people who've had it, there is a lingering period of ongoing fevers, and it doesn't really count as being completely symptom-free until you haven't taken any acetaminophen, Tylenol, paracetamol, whatever you want to call it, to modify your signs and symptoms.
Right.
So probably got at least another week of me if I stay well. Well.
Yeah. Yes, yeah. Of course. You look a little bit perkier than what you were a couple days ago.
I think this is the best I've felt since Monday. And last night was the best night of sleep I've had since last Monday night.
Yeah. So Monty, you could be a frontline healthcare worker. You've been in critical care, but the question is, have you been working on the front lines recently? And do you think that's where you contracted COVID?
No, so as I said, I chose to self-isolate because I was able to, on the nature of the way that our rota was coming through, because I volunteered to rejoin critical care. So they said, when are you available from? And I said I was available from the 1st of April, and then went for the self-isolation approach to try and stay well leading up to that point. I was also getting quite frustrated with people who were continuing to travel in and out in London, for example, in and out on the tube, to go to meetings that really didn't need to be face-to-face meetings, and therefore effectively accelerating the spread of COVID-19. Now, people would say to me, well, hang on a second, you stayed at home and you've got COVID-19. So no, that's not the point. I'm here with my immediate family who've been self-isolating, and on a balance of probabilities with 2 students, one at school, my wife who works at a school that closed relatively recently. On a balance of probabilities, I got it from them. That's much more likely that asymptomatic school children and students have brought it home and given it to me, as opposed to me, who hasn't been anywhere near, has given it to them. However, if I had been to work, there's no doubt that they'd be badging me as the source of the infection. This is a very important learning point for everybody, because it's not about you getting it, it's about you giving it. So if I had been going in and out to work, I would have been contributing to that equation that Hugh Montgomery describes so eloquently, is that if I give it to one person, I might as well have given it to 50,000 people.
Yeah.
Now, sadly, we might be seeing the inevitable results of that manifesting itself in our political leaders. Prime Minister has just been tested COVID-19 positive. Our Health Secretary, Matt Hancock, has just been tested COVID-19 positive, or at least he's got mild symptoms and they're self-isolating. They're likely been contaminating each other since they gathered in Parliament and announced the first of their colleagues that was off work COVID-19 positive. That was probably their contagion rapid spread moment, where they gifted it to each other. And with lots of understandable public criticism, continued to engage in face-to-face meetings. I can understand why they did it, because none of us have been through an epidemic before. I think we'll behave very, very, very differently the next time.
Yeah.
Sorry, a little bit of a speech there, but, it's important. It's hard for us to get our heads around to say, well, you stayed at home, you've got it.
Yeah. And then you kind of think, well, the cat's already out of the bag, so what does it matter at this point? But I think it still matters, don't you?
Well, it matters enormously, and sadly, I think we may have missed our opportunity in London, but there's lots of opportunities for healthcare systems elsewhere that haven't got there yet. Is we have, I hope, blunted the curve on the patients. There's still going to be a lot coming through, but I don't think we've blunted the curve on our colleagues, because I think during the period of contagion, people are continuing to gather in packed rooms and do handovers, and there's tweets and pictures up every day of the week of people not self-isolating at work and or continuing to go to work for meetings they do not need to be there. Real leadership now is not walking the floors. Real leadership now is being seen and heard clearly on your laptop, communicating from home. So it is no longer clever and saying, well, I'm a great leader because I'm seen at work. Great leadership now is protecting yourself so you can continue to be a great leader. There's a reason Winston Churchill took to the deeper bunkers when it got serious. He didn't take to the turrets.
Yeah, that's a great point. And I think that for healthcare workers, I mean, it's hard because you go into your hospital and you think, I mean, you're not thinking like, oh, I have this magical bubble around me. Everybody's there contagious, but it's tough because you're still trying to do things like I always do, taking care of patients. And that involves close quarters and those meetings and the break room and the cafeteria and everything. But in reality, that's probably going to be, something that is a downfall. I know that there are a lot of facilities, at least here in the US, that are not mandating that people wear surgical masks to prevent spread within the hospital outside of the OR. I mean, what do you think about that, Monty?
I think now is the moment. I mean, we have sometimes laughed at our colleagues who've experienced serious viral outbreaks in other parts of the world about their persistence in the wearing of surgical masks in public. Now, I think in the future, either we will A, be doing that ourselves much more commonly, or B, will be applauding them for their contribution to society and foresight. Because the surgical mask is not there to protect you, it's to protect others. Mm-hmm. It doesn't protect or filter that much of the air in the way out, but it does reduce the spray that inevitably comes as you speak. So I'm speaking now, and in front of me is my computer, and for probably as far as my windows, which are up to 3 feet away, there'll be droplets hitting it as I get more animate with my speech. That's why they're wearing those masks. And it was interesting, I said, we both watched, I think, a webinar from the European Society of Anesthesia. Well played to them that the speakers in Italy and in China and in Germany were wearing surgical masks, even though they were on a webinar on their computer in the isolation of their own office. That is good from the point of view of not contaminating the keyboard for the next person, which they're going to wipe down afterwards, but reduce the spray load. But also the symbolism of it is important.
Mm-hmm. Lastly, while we're talking about your battle with COVID-19, what have been some of the signs and symptoms? How did you notice it kind of coming on? What were some of those very, very early symptoms to some of the worst things that you've been experiencing?
So first thing to note is I was symptomatic. So I had what typically people would wave off as being a mild cold. I had a little bit of a runny nose, a little bit of a sore throat. I did not of note have a cough, and I did not of note have a high fever. Now, as we look back at all of the data from Wuhan coming forward, anything you can think of is on the list of signs and symptoms of COVID-19, including absolutely nothing, e.g. asymptomatic. The first tipping point for me, my first oh no moment, was last Monday night when, in the middle of the night, I had rigors. So rigors being that feeling you get with flu, such that you feel very, very cold and are shivering and at the same time sweating, even though when you measure your temperature, it's elevated. So mine was up around 38. You'll have to translate that into Fahrenheit. And at the same time, that first night, really horrific nightmares, very, very, very vivid nightmares that have been described. The following day, just muscle aches and feeling weak. And then remarkably, a bit like it's time programmed, at about X o'clock, the fever came back again, you get a little bit muscle achy, and then the following night, a similar cycle. And then so it was the third night of that I arranged to get tested because I thought, well, I've got COVID-19 now, until proven otherwise. And the reason I needed the test is because if I didn't have COVID-19, I could go back into the workplace more quickly. There's no different treatment to be done. There's no different behavior patterns because we should all be self-isolating anyway. So, we at home have all assumed that the others have got it. So it doesn't suddenly mean that now Dad's been diagnosed that everyone has to behave differently. Yeah. We behave the same as we were before. Yeah. The difference is I can't go back to work for another week. And if I'd been tested negative, I could go back to work as soon as I feel well.
So Monty, whenever we, in the past several weeks, have been doing screenings for patients or just anyone, to determine whether or not they have COVID or not before we could rapidly test and have access to the test. Do you think it was the right thing to be screening patients for fever, cough, and if you've traveled to Italy or China?
So I'm no expert on this. I think I'm becoming rapidly a sort of amateur enthusiast. But our public health experts who deal with epidemics or have dealt with epidemics on more educated and more regular basis would say absolutely yes. Screen, test, isolate, source isolate, understand, control, which I think our colleagues in countries that have this is more familiar to them did much more effectively and much more quickly. Now, when we get through all of this, which we will, as I said, I think we will behave very differently the next time.
Yeah, absolutely. Lots of lessons to be learned through this entire process.
We won't be laughing it off next time.
No. It won't be a hoax or
conspiracy or whatever it is. But
yeah, for sure. Well, Monty, I'm glad to see you looking so well. And I'm glad to hear you sounding so well.
You're a great liar, Desiree.
Well, you look better than you did look the last 3 days. I had to tell you.
Great radio face.
Podcasting face. A great podcasting face.
It is interesting how well you can feel compared to the nighttime. For my last few days, for a number of hours of the days, it gives you this real false sense of wellness for a period of time. Yeah. And then it hits you. Man, it hits you hard when it hits you.
That was on March the 27th. Here he is, April the 7th, speaking as part of an interview with Dr. Geoff Lacey.
I'm joined by our editor-in-chief, a COVID patient himself, for our conversation today, Monty Mythen. Hello, Monty.
Hey, Desiree, how are you?
I'm doing well, but the question is, how are you feeling?
I'm feeling much, much better. As I said, the bounce back wasn't as hard and fast as it has been for some people, but I've been triangulating with my middle-aged buddies, those people who are more around 60 rather than around 40. And they all tell me that it's a slower bounce than we necessarily anticipated, but it's definitely a bounce. I've just been out for my third getting brisker walk, and I'm feeling stronger the whole time.
Oh, that's great. You said you've had several friends that have actually had COVID, right? Yeah,
it's no longer a fashion item anymore.
Yeah.
It's not. I'm not even going to get the t-shirts printed. It seems to be becoming a lot more normal, and I'm getting quite interesting because none of them. This is because the healthcare provider testing has come online, so it's been very common to discover it amongst the acute team because obviously they've been at work and probably in the contagion phase of it, but also getting some heated feedback via text and messages from friends now who are saying, I can't believe it, I'm still getting these messages about cough and fever coming through, including a relatively recent government communication, whereas none of them have had cough and fever. They've all had the whole potpourri of other relatively niggling little things that has been followed by getting quite unwell, but definitely starting off with dry eyes or a snuffly cold or a dry throat or the really quite common loss of smell and or taste.
Yeah, we did a whole episode on that this past weekend about how it's a bit of a misnomer to say that it's just cough and fever and hope that we know that we probably missed a whole load of patients.
Joking about the fact that many of us lost our sense of taste about a decade ago. If you see what I mean, but we're all quite keen on our fine food, etc. And having that, I'm lucky I haven't lost my smell.
I was just going to say your smell and taste of wine, you never have a problem with.
Steady now, other drinks are available. But they are saying it's really quite, the smell thing in particular is relatively common.
Oh, that's crazy.
By April the 11th, Monty was back to full health. Have a listen to him here, having some fun with Jeremy Sassoon on the special charity concert episode we did recently.
Today, I'm joined by our editor-in-chief, recovered COVID patient, and critical care physician in London, Monty Mythen. Hello, Monty.
Hey, Desiree, great to see you.
It's good to see you.
Happy almost Easter.
It is Good Friday here for those practicing Catholics and Christians. And Passover coming up tomorrow, I think it's going right now.
In London, it's just another day of the week with what's happening at the moment.
Exactly.
So quite,
I think there's definitely a little bit of disruption in how we're going to be celebrating holidays, I think, for a while. But Monty, how are you feeling?
I feel much, much better, Desiree.
Good.
I think we should move on from Top Med Talk being about me, because I think unless I deteriorate, I think I'm there.
I think you're almost out of the window.
Hospitals again today. I was in a couple of our hospitals again today, catching up with people. It's very challenging in there, as we keep talking about, but they're doing a fantastic job.
Yeah.
And I'll be in for the weekend.
Thanks for listening to Top Med Talk. We hope you found something useful in that information that we've given you. This piece is not intended to either make people too comfortable about the dangers of COVID-19 or to overly frighten them. It's an attempt to tell the story of one patient who had COVID-19. We appreciate the potential seriousness of this virus, and particularly healthcare workers in our team have had direct experience of it. We hope you're safe, and we hope you can continue to listen to Top Med Talk. Don't forget to subscribe and connect with us on social media, either Twitter, Facebook, LinkedIn, or our own YouTube channel. Also, if you'd like to feed back to us and be involved in a future program here on Top Med Talk, email contact@topmedtalk.com. Or if you want to email me personally, I'm the producer of the show, nick@topmedtalk.com. Hope to speak to you soon. Thank you for your emails from everyone who's already emailed us. We couldn't do this show without you. Also, speaking of which, of course, thank you to our sponsors, most notably Edwards Life Sciences. We literally could not have done this without your support, and we're very proud to thank you here on Top Med Talk.
Top Med Talk.